How are we going to work this out with doctors?
It's a big challenge, and there's really no one organization in place to address that on a statewide basis. The state government does have is making some efforts in those areas. A lot of the hospitals in the state are trying to recruit the bigger hospital companies, have more financial fortitude for doing those kinds of things. But a lot of the smaller community hospitals, really are struggling. What's going to give, quite frankly, is going to be the health care of those individuals, because there aren't even enough of those providers to be able to make up the difference and have adequate coverage for all of the people in the state that are going to have some kind of financial assistance to getting care. But if there's no provider there to give them that care, it really doesn't put us a step forward in that regard.
So I guess the waits will be longer then.
The waits will be longer. But it's a big problem, and there's nothing in place that addresses that issue. And on a macro scale, we're not producing enough physicians to meet that need, or even the combination of physicians and nurse practitioners and other providers. We don't have enough bodies to cover the care for all of those individuals.
Are you skeptical that this whole Affordable Care Act thing's going to work out for the better?
I have my concerns about a lot of aspects of it. As I said, I'm delighted at the thought that some individuals who didn't have access to care will get it, at least to some degree. Whether or not that's going to, that benefit is going to outweigh the cost to society for putting all of this into place, I have a lot of concerns.